I'm Dr. Carlos Berio from Spark Physiotherapy. Today we're going to talk a little bit about some of the problems in the physical therapy field and how we have some of the solutions. You know, there are a couple of problems in physical therapy currently. A lot of what we're seeing in our practice is that care is being driven by volume-first kind of approach. Third-party payment is always being reduced. We're seeing reimbursement from the clinics that will bill your health insurance come further and further down. And what's happening is that quality piece is being lost, and the client is the one, unfortunately, seeing the brunt of that. We have this thing we call physical therapy mills. We kind of place every one of the clinics that operates in this way in this category. It's kind of like a factory. You can think about churn and burn type of system. Many people have already experienced this, where you might be in a clinic with 2 or 3, maybe even 4 other patients at the same time, and that one therapist is struggling the best they can to try and see everyone, get all the documentation done, and then of course make everything line up so that reimbursement makes sense. These mills are unfortunately the majority of places where people get physical therapy, but they are one of the biggest cancers to the field currently, and what we need to do is help people find places where they can have all the way well care and be seen with a high level of quality. You know, when people wind up in mills who require a lot of hands-on care or a lot of patient education, their ultimate outcomes are really what's at stake here. Most people are seen for a much too short a period of time by the professional. The length of their care is usually stretched way out. A lot of times it's because, as therapists, we're always troubleshooting what the problems may be and trying to find the one thing that we can impact to get that person better. Sometimes we'll do a technique and see whether or not that works, and that will help us make our decision about whether we think one problem is the main issue or the other. When we only have 5, 10, 15 minutes to do techniques, we have to actually wait for that person to kind of respond to it. Maybe 2 or 3 days later, they actually will come back to us and say, well, that worked or that didn't work. And that during that time, that person's in pain. That person's moving around their pain. That person is compensating for that pain. Instead of 100% of the time being able to say, I feel better now. When we treat clients, we are able to do some of that troubleshooting along with a very, very comprehensive history and get people pretty much feeling their pain reduced right then and there, and then also having been able to better formulate the plan that's going to get them all the way well in the shortest and most efficient way. You know, the nuts and bolts of it comes down to whether the person needs all the way well care, good enough care, or all the care that they need to get back to what they want to do. Customer service is completely going the way of the dodo when it comes to clinics that seek reimbursement directly from health insurance companies, those PT mills. Because so much volume has to be driven there, people really don't feel that they're part of the experience. They almost have to feel like they're kind of a burden to the therapist. The therapist is doing the best that they can and you know, trying to take care of all of their clients at the same time, but it's not possible for the quality and the level of customer care and customer service to be delivered in those settings. Very differently than can be seen in a setting where you're seen eyes-on, hands-on by a physical therapist who's trained in the movement science, who's trained in strength and conditioning, and some of the manual techniques that we place such a high priority on. Quality is the key. Length of stay in the treatment phase is really, really short. High efficiency, high quality. People really enjoy the experience and get back to the things that they love doing as fast as they can. I hope this was helpful in getting people to understand the difference between a physical therapy mill and all the way well care you can get, like you can get here at Spark Physiotherapy. We'll see you guys soon.